Good morning. You see what I have in my hand here. This is the Fiix elbow device. And in this video, I'm going to go over my review of the device itself. And then I'm going to talk about the program that you go through while using the device. And then I'll wrap up by talking a little bit about my experience and kind of my symptoms and kind of as I progressed through. So I'll chapter the video so you can just jump around and watch what you want to. The reason I'm doing this video though is because no one else that I saw on YouTube had a kind of a real average Joe review. You can look at my channel and you can see I'm just a guy doing tractor stuff, so this is my experience. I'm not a doctor. I'm not giving you advice. I'm not telling you what you should or shouldn't do. I'm just going to share my experience. So let's get to it. Okay, so here's what you get in the box. You get the Fiix elbow device, the cream, the charger, the strap, an instruction booklet, and a quick start guide. So here's the device. Let me get this up in front of the camera here. You can see it. Try to get no glare. Come on. Here we go. So there's the device. I will turn it on. Let's turn it over. Turn it on. And the options are pretty simple. You play to go, and it counts strokes, or you can make the time less than 10 minutes. You can't go more than a 10-minute run, though. And that's about it. Or you can stop it. So it's counting strokes. It's showing your battery level. And that's all there is to it. The strap is sort of okay. It's a little stiff. It loops based on your arm size. It loops around one of these metal hooks and then up and over, and then it's supposed to go around, your arm. What I ended up doing most of the time, especially toward the end, was just sitting it on my arm and positioning it right. And then I'd be propped up on a pillow and then just kind of hold it as it does its thing. And the unit itself, it's heavy enough that it does provide quite a bit of down pressure. So the strap, I think more or less is just holding it so you don't drop it. So it's probably a good idea from that perspective. But the strap's not really providing, pressure on your arm. Here's the cream. So I went through the program plus a couple of weeks, and there's how much cream I have left. It smells kind of like, I don't know, Fiix maybe. It's not that, Fiix is bad. That's not it's close to that. So do I like the device? Yes, I do. It's that simple. I mean, the device, how to charge well. It's convenient, as far as using it. I mean, really no complaints about the device. So before I get into the program, the one thing I will caution about the device is it is possible to overdo it. So if this device got too close to my elbow, or when I was wearing it, sometimes I would flex my wrist a couple times if I moved my hand position. That was just too much, because I guess when you flex and you're massaging, it irritated me for a couple of days. So it's best, at least for me, it was best to just hold still and let the device do its thing. So here's the program they give you in the booklet. What it consists of is 4 weeks of strength or of stretching, and then the device 3 times a week, and then another 4 weeks of strength training and the device 3 times per week. So I'm going to put some screenshots in here. The app tracks your progress. It gives you daily reminders. It tells you if you don't say done in the app, it will show as a non-compliant day. So you're able to see your, compliance rate for the program. And then over the 8-week period, it charts your pain level because you are prompted with survey questions at the end of every week to chart that progress. So in my case, I had already done 4 weeks of physical therapy. I think probably 7 sessions or so, a lot of sessions, and they were like $200 a pop. And then I stopped and started doing this Fiix elbow program. So in my case, I didn't do 4 weeks of the stretching. I started out during that 4-week period with the 1 pound weight. And I stayed on 1 pound weight for probably 3 of those 4 weeks. And then I think the 4th week I went to the 2 pound. And then when the weeks 5 through 8 period started, that's when I started progressing up. And it actually took me a long time to get to the 5 pound weight. But I'll talk about that here in a moment. So the progression I did was 15 reps. And then I worked up to 3 sets of 10. So 15 and then 2 sets of 10 and then 3 sets of 10 over like a 2-week period. And then you repeat until I got up to the 5 pound weight. And there were times where I went, say, from the 2 pound and I didn't have a 3 pound, or no, I'm sorry. I went from the 1 pound to the 3, didn't have a 2 pound weight, and I wasn't ready for the 3. So I had to go out and buy a 2 pound weight. I had to go out and buy a 4 pound weight. So that's one thing they don't really specify in the program. They just say use for the strength training, use a weight. To me, I had to work my way up, and that's what they taught me in physical therapy as well, in very slow increments. And if you work your way up and you cause irritation, take a step back. And then the other thing I did was my irritation was in my right arm. So when I did this strength training on my right arm, I also did it on my left arm to keep my left arm strong, because you know what happens when one arm's bothering you, you'll tend to favor the other arm. And if you're going to favor that, you're probably going to cause some irritation there. So that's kind of the difference. The weight progression is really the only big difference that I had in the program as far as what I did versus what they recommended in the pamphlet. Okay, so what were my results? I think pretty good. Right now, I'm in almost no pain. Yesterday, as a matter of fact, I pushed my limits and I have a little bit of irritation in the arm today. Very, very minor though. So let me start by telling you my timeline progression here. I was in the hospital I'll say just month 0. I was in the hospital because of my back. The recovery from my back required a lot of physical therapy using my arms. Then spring hit about 3 months later and I had stuff to do outside. I'll put a clip in here, like doing some seeding and raking out back. And it was like a couple days after I did that, I started getting irritation just out of nowhere in my arm, my right arm. So I kind of let that drag on for 3 months. Then I said, this is ridiculous. I went to the doctor. He gave me a cortisone shot in the arm. 2 days later, 0 pain. And that lasted about another 3 months, but then it came back. So I went back to the doctor and he said, you know, I think you should do physical therapy because it's been pretty, you know, short period of time since you had the shot. So let's try PT. And my arm wasn't super inflamed at that point. So I started the PT, and I'm telling you right now, there was some pain. It was not like a cakewalk. What I did like about the PT was that he measured my grip strength and like how far I could bend, and like with instruments and angles and stuff right out of the gates. And then we repeated that again after 4 weeks, and it was a drastic improvement to the point where actually my right hand that I was working a lot had more flexibility than my left. So during that period of time, I was in so much like agitation type pain. I even went to the point of trying dry needling. Just once. I did not like that. So anyway, I did the physical therapy and then I started this program. So I'm about 1 year into it at this point, and I think I'm mostly pain-free. So now let me go through this list here and tell you just some things that irritated my arm. It's so aggravating trying to figure out what your trigger is, because when I look back, I say, I know what really started it. It was overusing my arms with back physical therapy and just, you know, supporting my weight at times when my back was still weak. But it was also this, right? It was typing on the keyboard. There's no doubt about it. Typing, and then I also noticed I had gotten into this bad habit of pitching my right wrist up in the air, sort of hovered over the number pad on the keyboard in a state to be prepared to type. So I was in this position for hours on end every day. So I got to the point where flossing my teeth at night caused pain. Holding my phone in my, just holding it like this caused pain. Pulling the bed sheets up caused pain in my arm. Washing my face, lifting my arm up, it actually even started traveling. It felt like there was some pain traveling elsewhere in my elbow as well. And I guess that was just due to kind of behavior modification because of the pain down here. Put my shoes on, my right shoe, that was bothering me. Sometimes in the shower. I mean, this was bad. Like I was not in good shape here. So clearly, if you look at my channel, look at all the outdoor stuff I do, all of that was impacted by this. It was just not good at all. Driving, I've realized that was bothering me, and sleeping in certain positions. So what I realized, I'm going to stand up here. What I realized was when my wrist is like this, it was pulling on it. So sleeping, I would sleep with my hand to my side, or I would sleep, if I'm sleeping on my sides, I would sleep with a pillow between me instead, and not like this. So no rotation in my arm. And I noticed that really helped. When I started not twisting my arm at night in a sleeping position, and certainly none of this, and certainly no laying directly on the arm. But the twisting motion was actually irritating me laying in that position overnight. And then, of course, that was the same thing driving. If I was driving, I'd say, oh, well, I'll just use my left arm. But I would lay my right arm in my lap and twist the wrist, and that would irritate it for like an hour or two. So it was just really bad. It sucked. And then kind of another thing was just picking up a piece of wood for the wood stove. Hurt. Like, it didn't hurt right then, but it would be just enough to irritate the arm, and then the next day I would flare up. But what I noticed over time with this program, as I built strength, I noticed that if I did push the boundary a little too far, I'd recover more quickly. So at the beginning, if I did something to mess up and cause a lot of irritation, it would take me almost a week before I got back to the pre-irritation point of pain and ability. So the point I'm at now, though, almost a year later, is if I do irritate the arm, it seems like I recover by about the next day. It's maybe a day. It's certainly no longer than that. So the one thing they don't emphasize in the Fiix Elbow program, though, is the use of these wrist braces. And I'm going to stand up here. Do you see them? I have them on right now. So what I would do, I would just leave them down in my shirt cuff, because you don't want them on all the time. I would just leave them hang there. And if I'm eating lunch or whatever, I just leave them hang. And then I get back to type, I would just pull it up, get it in position, make sure it's in the right position, and now I'm good. Now I've got that support. And I did it on both arms because I didn't want overuse of the left, to start problems over there, because I was starting to feel some irritation over here. So I've got a brace here as well. And then the point I'm at today, I think I have about a face cord of wood down there I've cut up and split. With the splitter, not by hand. That is a way huge improvement versus I'm in pain flossing my teeth. So would I get this, go through this again? Yeah, I would. I mean, I'll be honest, there's some sticker shock buying the device. But I think it was worth it. Certainly the program for me was solid, and the exercises were solid. So if you like this video, please click the like button. If you like tractor stuff and some of the outdoor stuff I do, subscribe to the channel. If you have any questions about the device or the program, post it in the comments and I'll answer what I can. So thanks for watching.